Good morning. This is Dr. Beck, right here at LifePoint Medical, and I want to say good morning to you and let you know that there's somebody out here or an organization that will respond to your needs if you have any medical needs today. And we're open for business, and we are got 3 or 4 people answering the phone. So if you need to call us at 706-782-0016. You can email us at office@drtsbeck.com. You can also request an appointment on drtsbeck.com. And then you can text us at 706-949-1129. We want to hear from you, particularly if you're having medical issues. And sometimes people want to become a patient, and they want to know, or I want to let them know what I'm looking for and what they're doing. And so, my criteria for a good patient mostly has to do with the person's attitude. Okay. In other words, you got to be willing to listen and team up with my team to improve your health. We can't give you everything that you want, because if we don't think it's in your best interest, we can't give it to you. Okay. And that's a duty that I have to myself, to you, the patient, and to the public. But I don't care about how many medical problems you have. Medical issues are what we deal with, and I signed on to deal with complex medical issues. So those don't bother me. The only time I ever don't like patients is when patients are angry or mad, and they're usually inconsolable, or they're mad about something, and this makes it very hard. Okay. They're mad about something we can't do anything about. Okay. And that's part of the issue with all we do is number one, we're regulated by the state and the federal government. So that puts a stop to us, particularly with the pain medicines and controlled substances. They've really cracked down on those the last few years. So that's been a very big challenge for me. So we've got that issue, and you also have third-party payers. Okay, when I say third-party payers, meaning somebody paying besides the patient. And we do try to accommodate people who are self-paid, because I think that's a good thing, and I want to take care of people even if they don't have insurance. But the challenging part is when I see a patient who has somebody else paying for their medical care, whether it's Medicare or their insurance companies, and I think they want something done, or they think they want something done, and the third party says, no, we're not going to do that. So that always puts up a big barrier. A lot of times that happens with medications, and I even seen on the news where they're trying to stop the pharmacy benefit managers, the middleman for all the pharmaceuticals, because they've wreaked havoc on us since they came into place, I think, in 2005. That's really made our job a lot more difficult, because we're trying to provide people with medications, but sometimes the insurance company is insistent that they're not going to do that medicine, or they didn't contract with the medicine company to get it at a good rate or something like that. So that's a very big challenge. So if you are a patient who just wants somebody to listen to you, team up with you, and try to get you to the highest level of living and life as you can, and longevity, and trying to do good work for you, that's what we're all about, and we'd love to see you on that note. Now let's talk about flu shots. Okay, we've ordered our flu shots. I talked to my distributor this morning, and he told me that we should expect the flu shots in within 10 days, which is really good. I know a lot of people are getting them at the pharmacies, which is fine. The only problem is they kind of get a jump on the gun from us, and they get them before we do. It's not that big of an issue, but I don't think there's going to be a shortage of them. And we've ordered enough, or what we've projected enough to take care of our patient load here. So those should be coming in the next 10 days. And when they come in, I'm going to announce it on here. And people who are part of the chronic care management, we've got one for you. And we should have plenty, and we'll be able to order more if we run out. Okay, so we are thinking about the flu shot, and there's not a shortage. So if you do it now, I do think that the powers that be, CDC, is recommending we get the flu shots early, because we don't get the flu mixed in with the COVID-19, because a lot of them are very similar, and it's going to be difficult when you got the two different viruses circulating through the community. So it's very hard to distinguish between the both, and we know the testing for COVID is not that reliable. Okay, so we just got to be cognizant of that dynamic. So we are thinking about the flu shot. We are getting them, and we will let you know when we get the flu shot. As far as the COVID-19 goes, there's 299 cases listed today. Sadly, we're almost up at 300. Okay, but we have held this thing off tremendously, particularly with us having lots of tourism here in town. So I appreciate everybody's hard work. Let's keep doing your things. Let's keep social distancing. Let's keep using the alcohol, hand sanitizers, and wearing your mask when it's appropriate. We do have 7 deaths. I don't know where the last death or any of the last few came from, or I'm not aware of who it was. I'm always saddened by that, okay, but I still think we've minimized it based on what I've seen around the country. So keep up the good work. Remember, we're open on the weekends, and we have the women's clinic, and we're taking new patients on all of those fronts. So let us know if you need anything. This is Dr. Timothy Scott Beck. Everybody have a wonderful day, and let us know if you feel like you need to be seen or need to be heard for a medical condition. We'll help you, okay? Thank you.